Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes discussing the selling of the entire package of benefits that you have available through the carriers that you contract with that will satisfy your beneficiaries' needs in a tailored type of package, where we're looking to serve their best interest in a multitude of different areas, but we'll go through that in detail in just a little bit. Today's presentation is being recorded and will be made available on our website at premiersmi.com under the webinars videos section, and will also be on our YouTube channel as well. You'll notice in the course of the presentation that for folks that are more familiar with us here at Premier might feel that a bunch of this is or a number of the slides will be review. We're trying to appeal to a broad audience, so we ask your indulgence on that part of our presentation. One thing that we need to discuss as well is the software package that enables you to see these presentations. There's a section in there for both questions and chat. We ask that you put your questions in the question section. We will review them periodically throughout the presentation. We find that generally we answer most of your questions, the vast majority of them, through the course of the presentation, but we want to make certain that we maximize the value we get together out of the investment of your time in listening to me explain a computer system. So that said and done, let's start with a little bit of base information about Premier Marketing itself. We are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. Our offices across the country. We're licensed in all 50 states. We act as an insurance wholesaler through independent insurance agents such as yourself, and we do so through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. That portfolio of products are aimed at the Medicare population and the folks that are basically a few years from it, and it includes the basic Medicare programs, the Medicare Advantage, Medicare Supplement, and prescription drug programs. It also includes a portfolio of life insurance and annuity products, including final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits in different categories that are a big part of our discussion today. Those Medicare Advantage plans include the national carriers and many of the strong regionals across the country that can act as a difference maker for you in your market. And we carry over that same philosophy for the prescription drug programs. Most of these are basically part of a contract that you have with an MA carrier anyway, except for Mutual of Omaha. Their PDP product is something separate from their other programs, and Clever RX is actually just a discount program, not a sanctioned Part D program. The Medicare Supplements, full portfolio of products, our carriers there as well, and different marketing programs to ensure the success in this area at that Medicare demographic that benefits from these programs a great deal. We'll go through the detail on that in just a second as well. These ancillary products are crucial in covering the needs of the folks that we visit with, but they also give us an opportunity to make certain that we take care of that need, create additional marketing opportunities and additional revenue flow to our agencies as well. We want to make certain that we communicate properly with the folks that we visit, all part of the overall greater scheme of things. This is a guide to the different acronyms that are part and parcel of the Medicare programs. You notice on this particular slide, which is a few months old, 4,420 acronyms. It also gives us then the reminder that we need to make certain that we define what we're speaking of if we go into the use of acronyms, and to limit them if possible to make certain that we communicate properly. We have obviously a number of requirements placed upon us in the Medicare arena that affect all of the programs, and these are the standardized election periods where there's quite a bit of hubbubaloo coming up here now, because October 15th all of a sudden isn't too terribly far away. So the annual election period is front and center for many agents who work the Medicare market. There are, of course, other standardized election periods and special election periods based on a particular need, and a special election period based on some of the steps that are laid out there in response to circumstances happening in a particular area. All this is important because the majority of people last year didn't review the plans. This is, of course, an older document from Kaiser Family Foundation, but regardless of the base programs, folks aren't looking at their benefit package year over year. So much of the activity that we have here in the next month or so, in addition to making certain that we're handling the benefits for our folks for 2023, there is a very good possibility we're going to run across people that may need our help yet for 2022 benefits. And you have those special election periods that enable you to do so in many circumstances. Same thing applies to the standalone Part D prescription drug programs as well, because folks just aren't using the tools that are out there. These are governmental supplied programs that really haven't had the use that you would think. I'll guarantee you a whole bunch of folks, if they get their Medicare and U book starting in just a little less than a week, a whole bunch of these will start to go out either electronically or by the United States Postal Service. This is a great tool for us to use, but a whole bunch of folks don't read it. They don't use the apps that are available or even the other types of information dissemination on the internet. So what we need to do is make certain that we're able to handle the folks and their particular need of how they want the information we're about to share with them. Are we doing it virtually, sending them things through email or whatever, or visiting with them right off the bat, face to face? Or is it a combination of the two? We see a lot of agents that have gone totally virtual, and we see a whole bunch of them that are in this area right here, where they're a little bit of a hybrid, doing what they need to do in order to address that particular person's preference for delivery of information. And let's face it, since the pandemic hit, since COVID-19 became such a strong part of our vocabulary, well, since that time forward, the Medicare generation has been trained on receiving information electronically by their doctors, by their specialists, by their dentists, by hospitals, even by their faith-based families to receive information virtually. So it gives us the opportunity to maximize the number of folks that we can touch, doing so compliantly, and making certain that we can deliver upon that need for the information to make a good choice moving forward. So as we look at our topic in detail today, we want to make certain that we realize the Medicare market opportunity. Well, if you're on this call, you realize how big it is. Near exponential growth of the aging of the baby boomers. You come on these, you hear the silver tsunami, one every 10 seconds, 10,000 plus a day, tempered a little bit by the folks that are holding off on accessing benefits completely as they turn age 65. And then, of course, there is that population that's under the age of 65 that are accessing Medicare benefits because of disability. We want to be prepared to help folks in each of these categories, and we can use the Medicare and U book to do so. It gives us a great reference tool that we can use in our discussions and covers a lot of the questions that we may have to answer that are brought up by the folks that are visiting with us. There's a commercial, one of the million commercials for Medicare products right now about Medicare Advantage plans, saying, one of the actors on it, well, we've got Medicare, we don't need anything else. This gives us then the information we need to illustrate the different parts of Medicare and how there are financial pitfalls, shall we say, covered under the hospitalization coverage, covered under the Part B coverage, and how those dollars can add up very quickly. And then, of course, the programs that Medicare doesn't cover, because there are certain things that aren't covered services, and we want to be prepared to be able to discuss them. So what's not covered gives us then an opportunity to bring into play the discussion of, here's an examination of our base benefits for some of the things that we need to do to cover the Part A and Part B deductibles and coinsurance and other fees that are associated with it. But then also speak to the programs that Medicare doesn't cover that many folks assume, well, I got coverage for that with Medicare. It's a bit of a stark reality for a whole bunch of folks to see that some of the stuff that they may have been accessing, some of the procedures that they may have made use of or needed in the past that might have been covered by their group coverage or even by some of the ACA programs, well, they're not covered here. So what do we need to do to take care of them? That gives us that discussion to roll into our entire portfolio of products, cherry picking what may well best suit their needs. So that gives us then the opportunity to take care of those choices, because they can actually decline Part B if they wanted to. Some of them for good reason, because they're still covered by their group coverage. Some of them because they don't want to pay that expense, but that's still a small percentage of the Medicare population. You have folks then that will choose to self-insure for the base medical instead of taking out a Medicare supplement plan, the standardized, modernized Medigap plans. Well, some folks do that. Some folks don't. Some folks go into the bundling of the benefits through the Medicare Advantage plans. And we'll discuss some of the particulars here in just a moment, and include in, there are folks out there that pick up a Part D plan when they were first eligible because, hey, I don't take any medications. Then life catches up with them a year later. Gee, I've got 6 meds I got to take. I got to pay a penalty. What we're seeing is, by the information that's given to us by different research companies, including Deft Research, and it tells us that there's basically a pretty even split, particularly prior to the pandemic hitting, between the base medical coverages and the original Medicare. That could include folks that have just original Medicare, folks that have retiree programs through an employer or a union group. It might be folks that have VA coverage. There's a number of different reasons why someone may be still categorized as Medicare only. That gives us an opportunity as well. The pandemic did change some of the ways that people chose benefits, because they're doing a lot of online shopping and that sort of thing too. We saw a surge in the enrollments in the Medicare Advantage arena, perhaps even overtaking the Medicare Supplements as a percentage of folks accessing additional benefits. And we can see that Medicare Advantage plans have been on a really strong upward curve as to their overall enrollment. And we see that this particular piece telling us from Kaiser Family Foundation as well, that almost half of the people on original Medicare have chosen a Medicare Advantage plan at this point in time. And you saw as well that 9 in 10 Medicare beneficiaries either had traditional Medicare with supplemental coverage or were enrolled by Medicare Advantage. So you're seeing a increasingly large number of folks making a choice between the two instead of self-insuring as they had in the past. Maybe that's due to a number of the no additional premiums for Medicare Advantage. It may be more of a reasoning because of extra publicity that's put on for these programs and the choices that need to be made here in half a month, or a month from today, or a little less. So it gives us then that opportunity to realize that as well, that one category where I showed, well, they may have other coverages. Well, 1 in 5 traditional Medicare beneficiaries and no supplemental coverage. So we have 20% of that Medicare population that may respond to some of our efforts now for 2023 because they figure that's all they can do. Or there may be people in that arena that say, hey, is there anything I can do for me now? And that is another sales opportunity. It's also important to note that folks realize that traditional Medicare doesn't cover prescription drugs. It has to be covered through the, well, at least outpatient drugs, the standardized Part D prescription drug programs that are available through the different insurance companies that have been vetted and their plans reviewed to be able to offer that coverage. So one of the first things we need to do when we look at selling the entire portfolio of products to the Medicare population is put aside some of our own preconceived notions and realize that one size doesn't fit all. There are a lot of agents out there that are Medicare Advantage agents. They can't understand why somebody on Medicare would pay a premium when they don't have to. And then you have the other side of the fence where the Medicare supplement folks are saying, why would anybody submit themselves to a network? We'll see as we go through some of the slides that follow why it's appropriate to offer both based on statistical analysis and the best choices that are offered to the Medicare population. One of the things that we have available to you as an agent contracted with Premier Marketing are also different forms in there that can help you determine on a fact-finding basis what their best option may be based on their particular circumstances. So those are tools that are available to you through our organization, not only for Medicare beneficiaries on the health coverage, but also the other programs that are out there that we need to help these people be aware of. And it may require a second appointment after a 48-hour cooling off period if we have approached them on a Medicare Advantage or PDP basis, but it's a great way of cross-selling because in a whole lot of those circumstances, if you're going back to them because you can't discuss long-term care or short-term care, you may have some base information available through your fact finder on Medicare that allows you then to present detail to that individual based on the needs that you've uncovered during this fact-finding opportunity. And that is an additional form that's available to you. When we look at some of the things that might help us determine what is the best choice for an individual, well, I remember a long time ago, a sales manager of mine at Prudential said, what's the best type of life insurance? It's one that's in place when the person needs it. And I think that goes to some of the detail that we have when we're looking at Medicare Advantage versus Medicare supplement plans. Can that individual afford a Medicare supplement plan? Do they have a way of dealing with the premiums that come as part of it and realize that they also have to pick up a Part D standalone drug program? So money's in the household. Well, that can be a determining factor as to what the choice is. We all would like to drive a Lamborghini. I'd like to ride in it. Drive it, yeah, it's kind of scare the hell out of me, but it gives us then the opportunity of making certain that the vehicle we help them select will be in place when they need it, and it is appropriate not only for their medical needs, but also their entire picture of their household budget. We want to make certain that they have the plan that they can afford and that they can use on a regular basis. So when we look at some of this detail upfront, close and personal, it gives us then the information that we need to help people make their choices. And particularly when you look at some of the detail of these, you'll find that about half of the population, well, obviously, is below the median income of an individual. And that can be a bit of a challenge for folks because, well, gee, do we want to cut our budget here or do something else here to handle the premium of the Medicare supplement and the PDP program? Or do we need to thoroughly investigate the Medicare Advantage opportunity? So this is actually a cutout piece. This piece is borrowed from United Healthcare, and it speaks to some of the differences that we see between Medicare supplements and Medicare Advantage plans. So big first difference is network, a referral process to that network, and how the restrictions of that network may be in play based on where the individual lives. We're seeing a lot of the Medicare Advantage programs address that here, particularly in 2022 and going into 2023. The process of actually enrolling the individual. The Medicare supplement plans, we'll talk about the detail on that, when you can and cannot. And then, of course, we saw earlier in the presentation the different periods in which a person can enroll or switch Medicare Advantage, and it should say here as well the PDP programs. There are the costs that are associated with it. When I first started selling Medicare Plus choice plans last century, boy, that makes me feel old, you had an educational process for a lot of the folks because, oh, gee, too good to be true. What's the catch? What's it cost me? Well, the Medicare supplement plans have a premium based on area and age and whatever the pricing of a particular carrier chooses to offer a particular Medicare supplement type. You see a lot of no premium Medicare Advantage plans, but they have the co-payments that go along with the program that may be a deciding factor when you look at particularly their MOOP, their maximum out of pocket. So it gives us then the detail that we need. We spoke of the prescription drug coverage earlier on the Medicare Advantage, or pardon me, the Medicare supplement side, where if they wanted the drug coverage for outpatient medications, they're going to need a Part D plan. Most of the MA plans, the Medicare Advantage plans, are MAPD programs, Medicare Advantage prescription drug programs, where that coverage is integrated into the plan itself. All that said and done, as to information as to how that difference can help you determine what may well be the best choice for your prospect or client, we need to look at some of the information that are the differences between these plans as to what is asked of you by the Medicare Advantage or Medicare supplement carriers. A big deal in the Medicare Advantage world for some folks is the fact that it does require annual certifications. A whole bunch of that has been going on since June, July, believe it or not, for those unfamiliar with it. And it's a process that isn't quick in certain circumstances and can be increasingly challenging because in order to pass, the percentage of questions that you can miss is diminishing. It seems like annually. There are also annual coverage changes in both programs, but the program changes that you see with Medicare supplement plans follow the coverages that are offered by traditional Medicare. So that deductibles and coinsurance, the Medicare supplement plans morph to cover those additional dollars. The benefits stay the same. They're standardized, modernized plans. And so if a person picks a plan G, that's what they got going forward unless they change the coverage. Medicare Advantage plans, however, well, the benefits can change. What we've seen is a push down in price, particularly of the PDP programs and the Medicare Advantage plans, where if there is a premium associated, that's being shrunk, but you still have different coverages within. And what we've seen lately is, of course, more benefit available in the ancillary area where these companies are putting their dollars. There are also different regulations as to how you can market one or the other. A big topic right now is call recording. You have to do it with Medicare Advantage plans, not necessarily with Medicare supplement plans. And if the topic bounces back and forth, as it generally does, you need to be recording that call. We've got a way to do that, however. There is, of course, too, the different things that you do in the community that have to be set up and registered in order for you to go through those compliantly, which segues us into the compliance differences. You can door knock for Med Subs. You better not for Medicare Advantage plans. There are different programs, once again, that I mentioned, a new requirement, perhaps in response to all the celebrities on TV pushing a Medicare Advantage plan one way or another, sometimes a tad deceptively. Well, we are the beneficiary of that activity where it has brought about the requirement for call recording. There are different bonus programs available with certain plans. With Medicare Advantage programs, the max top is set by the government, so they can't have bonus plans. You'll see in the Medicare Supplement arena, however, that many of those programs will offer a marketing incentive of sort, marketing support, administrative support, whatever shade of lipstick they want to put on that pig, that will give you additional dollars on top of your commissions. So that's something to be aware of. Can't do that on the MA side. The contracting opportunities, I mentioned that because many of the Medicare Advantage plans are very structured as to how your commissions are laid out. There's a difference for a street agent level individual or someone that has an agency with an upper hierarchy contracting. They're pretty much set by the MA carriers. You got a little leeway, but not like you do with the Med Sup plans, where those percentages of commission vary in most cases based on past production, or in some of the lower tiers, you have a way of moving the number in a manner of speaking. Underwriting differences are big because there are guarantee issue and other ways of making certain that you can get med sups without going through underwriting. A number of them we'll discuss. But if a person changes plans and they don't have one of those windows, well, they've got to qualify for that program medically. Medicare Advantage world, yeah, man, they ask one question. It only really applies to certain types of Medicare Advantage plans, so it is not underwritten. There aren't any pre-existing condition clauses or layout clauses in this area. We'll go through in detail what the difference can be. So we want to make certain that we realize the difference between the plans and what it means to us as agents as well. When you look at Medicare Advantage versus Medicare Supplement plans, you'll see that a big difference. Well, you get up to the median or in that area of income, you're looking at, doing a little bit of quick math here, not as quick as I used to be, 50.6% of the population are falling into that under the median income. And many of those then will include the folks that don't have coverages or are looking for additional benefits. You get into demographics that are more likely to pertain to Medicare supplement plans. Well, you can see the differences that are there. You have one that is mid-range to lower when it comes to enrollments. One is mid-range to higher, depending upon the ability to pay, in a manner of speaking. When you look to enroll in a Medicare Advantage plan, many of you that are on this call realize this, but when I first started selling these programs, clear back when Moby Dick was a minnow, we had two medical questions: end-stage renal disease and hospice care. If a person was in either of those programs, we couldn't accept them. That's in addition to the regular, I'll put it that way, requirements that a person has to satisfy in order to be eligible for the plans, where they have Medicare Part A and are enrolled in Part B, and they live in the plan service area. So you don't have medical questions. So you don't have to worry about that segment of 17.1% of folks that are accessing their Medicare benefits under the age of 65 because of the disability. And that's one of the reasons why you see that population approached a whole lot with the Medicare Advantage benefit, because they're younger. They may well be very well accustomed to a managed care program. And of course, that no premium in many markets can make a huge difference. There are different types of Medicare Advantage plans, the regular MA programs, and then you have special needs plans based on different circumstances. And wow, my screen disappeared on me. That kind of shocked me. We see that we have a strong market to address year-round with these, because they'll qualify in the vast majority of cases for a special election period even now. And that gives us then the opportunity to speak with them, address their needs now, and put them in for a review as well. You may be able to do the same thing or both of those at the same time after the 15th until December 7th. And then we look at other sales opportunities through the end of the year for the Medicare population. So there's a bunch of people out there that will qualify for a regular MA plan and then for a chronic or a dual special needs program. It's important to note that many times a carrier will offer a CSNP, a chronic special needs plan, and it may well be the person that has that medical condition's best choice. It may not be in certain markets. So it's important for us to dive into the differences as well. So choices, there's a ton of them with the Medicare Advantage plans. There are a ton of them for Med Sups as well. But in this circumstance, we see across the country that there's over 3,800 different plans available in the states. You'll see greater competition in more urban areas. In some areas, I think I read an article just last night where Humana covers 84% of the country with a Medicare Advantage offering. United Healthcare, 76% of the country. More rural areas, well, that's a determining factor for you as well. There may not be a Medicare Advantage plan available. And so that requires a little bit of a different approach for the folks that you visit. How do you find these plans? Well, there are a couple different ways. Of course, there's Medicare.gov and the plan finder that comes with that software package run by Centers for Medicare and Medicaid Services, obviously. And it gives us the opportunity to look at all the programs in their totality, even if we don't contract to sell them. We want to be aware of what's going on. But then, of course, the folks that visit with us and that are part of our programs, they do have access to Medicare Center, which gives us not only the information on the plans, but the availability of capturing that scope of appointment and storing it for 10 years as we need to do before we discuss benefits in particular with MA plans. Don't have that with MedSup. Plus you're recording that call when we talk about the MA plans, but it gives you then the opportunity to do the before the appointment compliance and take care of the during and make certain that it's stored properly. All the information that's out there. And you can send them. You have a microsite. You can send them to your site for them to select programs from the carriers that you choose to put on that microsite, that Pearl. And there is, of course, also the opportunity to send them out a side-by-side comparison of what is, in your opinion, perhaps the 3 top plans for them to choose from. So a side-by-side comparison, all done compliantly through this system where you can't send out a comparison with a Medicare Health Plan Finder. When we look at Medicare Advantage plans, well, it's basically contracting out the administration of Medicare benefits through a standardized, or pardon me, through a company that has been vetted and approved with different programs in different areas to offer these programs. And these are the programs that you hear all Joe Montana, J.J. Walker. I've successfully put Joe Namath out of my mind for a second. Shoot, when you got Captain Kirk out there doing it, it's a whole interesting type of dynamic that virtually speaks to these extra benefits. And these can be a predetermined or a factor in a person choosing one plan or another, but that's important because many of these extras aren't part of a Medicare supplement plan. And when we look at this older demographic that, no, that's not your eyesight, that's me trying to expand a piece here for us so we can read it, just made it fuzzy, that we see the majority of people in this time frame are looking at and choosing Medicare supplement plans. And you'll notice also that the percentage of folks in rural areas that may well not have a Medicare Advantage plan, where that is obviously the choice that they would have to make to cover the shortfall in Medicare coverages. With MACRA legislation taking effect on January 1st of 2020, one of the things we want to be very well aware of too is what Medicare plans are available to the person we're speaking with. So if someone turns 65 after January 1st of 2020, some of the programs we sold the most of in the Medicare supplement world, the C and the Fs, aren't available to them. But the folks that turned or accessed Medicare benefits before that date, they still have access to those programs. So if you run across somebody that has a Plan F, you can quote them a Plan F because they are eligible to pick up that coverage. If they're after that date, So we got to look at the different choices that are available. And that's one of the things that may make a difference to folks that you're visiting with as to what they want to do for base choices. It may well not be because, hey, that's just a little bit of money out of my pocket with a Plan G for that Part B deductible. I'm good on a whole bunch of the rest of it and quite happy with it. So we just need to make certain that they realize there are different plan types. Software packages we'll talk about in just a bit and enable us to do that. It is important to note too that these Medicare supplement companies, well, the benefits are standardized. The basic benefits are the same. Some may offer additional benefits, but there are 3 states where they're standardized in a different way. And just because an insurance company is operating in a particular state, they may not offer all plan types. That can be a determining factor as to what choice within this choice we're making, because obviously we want to make certain that the plan they're looking for is available there. It is also important to note that certain states have guarantee issue periods based on, well, for example, they may be dictated by the birthday month for that individual. A few states have that. Or there are some states that allow a person to have a guarantee issue as well based on the anniversary date. Well, gee, that's supposed to be policy purchase. It appears I was getting a little tired typing that one up. So some different things we need to take into consideration if the folks determine that Medicare supplements are their best choice. Those 2 times that they can enroll through open enrollment or guarantee issue, well, a thing that I didn't note on this particular slide is you get paid differently on Medicare supplements that are put out during these different time periods. Guarantee issue, there are very few companies that will do more than just a stipend of a payment to you, no renewals. And that's because of the risk that they have to take on additionally because they can't underwrite. So some differences we need to know about open enrollment, which is the one-time only 6-month period when that person is allowed by federal law to purchase the Medigap policy, and then of course the guarantee issue rights that we kind of alluded to in the prior slides as to when those are available. There is, of course, the bugaboo that post open enrollment. Well, the company offering a Medicare supplement plan can refuse coverage to that individual based on the medical underwriting circumstances. So something to consider there as well. Some things that are specifically not Medicare supplements, but can bring up different discussions for you is, of course, if someone's calling a Medicare Advantage plan a Medicare supplement, well, that's a big no-no. They can get whacked for that. It's not. Neither are the standalone prescription drug plans. They're not a Medicare supplement either. Medicaid is not. The different programs offered by employer or union plans, including the federal health benefits, TRICARE and veteran benefits, are not Medicare supplements. Long-term care insurance policies are most certainly not. And then when you have the Indian Health Services, tribal or urban Indian health plans, a special type of program for that demographic, that's not a Medicare supplement either. So we need to be aware of the key differences between some of the base medical coverages that individual has. When a person looks at a Medicare Advantage or a Medicare supplement plan, we talked about Medicare Advantage plans having some of these extras, but there are some things here that aren't covered, as we talked about earlier, in either program. By itself, the prescription drug program, that can be integrated in an MAPD plan. MedSups, it's a standalone program they have to purchase. There are also different coverages on both programs that may limit coverage outside the United States. So does that mean we speak to travel insurance? The long and short-term care programs, a very underserved need, not covered by either of them. Some folks that get on Medicare will look at this skilled nursing facility benefit that's there for 100 days on original Medicare after a person comes out of at least a 3-day stay in the hospital. Well, that's not short-term care. That's not long-term care either. Takes care of people when they're looking to help them rehabilitate and then go home. Then, of course, the Medicare indemnity programs for hospital plans, because more aimed at the Medicare Advantage world, where you have that copayment when someone goes into a hospital, be it a daily rate or per admission. So these programs are very much of interest to folks that have an MA plan. They're still sellable to the Medicare supplement population, but because there aren't some of those same out-of-pocket expenses while on the plan, these are for, in many cases, with a Medicare supplement plan, the extra expenses that a person has with a hospitalization that aren't medical in nature. You have also a number of folks that may be very well aware of family history of cancer, heart problems, whatever it happens to be. The critical illness programs can make a big difference to help assuage that fear of the folks that we visit with. And sometimes it's just a simple question. You know, anybody that's had cancer and how'd they pay for it? Boy, you want to get into a discussion really quickly? Have cancer and ask somebody that question. Some different things that can come into play, because I don't know of very many households who don't know of someone that has cancer. Might be them, might be someone within their household. So that's a big thing to talk about. The dental vision hearing programs are a natural adjunct for Medicare supplement plans. And Medicare Advantage plans may offer some of these benefits, and it may not be enough. So that is something to consider when we look at some of the ancillary coverages that a person will need when they're on Medicare. So we want to make certain that we're covering a lot of these programs that, well, they're addressed in our what's not covered by Medicare webinars that we do, and by some of the slides that I illustrated earlier as to what is not covered, using that Medicare Bible of Medicare and You. Obviously, a thing to consider as well is, what do you get paid for these programs? Well, as I mentioned before, the Medicare Advantage and the prescription drug programs, the national commission rate will vary by area in certain circumstances, but it is set by the government. A carrier doesn't have to pay the full max. Very few companies don't. So that's one of the reasons why you don't see some of the bonus programs or some of the other things that you might see with MedSup. And I got to tell you, they're pretty healthy commissions. You do this and work up a book of business, because they are paid, most of them lifetime. And you'll see that the initial commission of that individual is halved in the renewal process, and it may also be prorated depending upon when you sell the policy, what time of the year. Same thing for Medicare Part D plans. These are programs that aren't high commission, but you'd be surprised if you work these in conjunction with the Medicare supplements, how quickly they can add up. Confucius say, many pebbles build a great wall. These most certainly do. They have been increasing in commissions, nominal compared to an MAPD plan, but the renewals, once again, are half thereabouts as to what the first year commission is. When we look at the Medicare supplement plans, this is an older type of illustration, because, well, depending upon the company you do business with, it may be a commission rate of 14% of the premium, or it may be 22, 24, depending upon how that insurance company offering that Medicare supplement plan chooses to market that, and how they're looking to pay the agents. Those premiums and the commissions are not set by the government, where you see it on some of the MA side. The renewals can add up here very quickly as well. Either of these programs, it's a necessity for us to do an annual review, because, well, if we don't, someone else might actually get in there and do it for us. When we look at the commissions that are available through the ancillary programs, you can see a commission rate on that vary according to the program type, the carrier that you offer. We see some things, this commission is basically a difference between, well, that says 25 to 25, it's supposed to be 25 to 45, same coverage, two different companies. So something to consider there as well. The renewals on the ancillary plan, well, in a rainstorm, they won't even wet the cat dish, as they used to say. They're nominal in the renewal rates. But an important point to remember is, particularly as we go into AEP, when do you get paid on any of these sales? The government tells the insurance companies in these two areas with MAPD and PDP programs, they can't enroll you upon enrollment date. They have to wait until it's effective. And the vast majority of those circumstances, well, you're looking at after the first of the year. Most of the carriers are really quick to pay the agents as quickly as they can after the first of the year. That's something to consider. So that is one of the reasons why people will bank on those enrollments, but they want to make certain that they have a Medicare Supplements to address the higher income individuals for one reason, but these are paid on issuance. And that is, in many cases, well, it could be the first of the next month. So something to consider there as well. Ancillary plans, they're paid when they're issued. And since many of those are not underwritten, they may be issued the same day you put in the application electronically. So we want to make certain that we realize how we need to budget moving forward based on some of the commissions that come into play. We see a near narcoleptic effect for many agents after the first of the year because they see that fat check from their hard work during AEP and they kind of go silent for a little bit. Well, you got to load the cart. Don't tell me about the donkey being blind. We got to work to make certain that we load the cart so we don't see that huge drop off after our first of the year commissions program. We have some additional guides that can help you in this area as well, created for your use through us here at Premier Marketing, working with one of the agent success managers, the marketers. They can get you these details as well. We have one set up for the Medicare Supplements and one for Medicare Advantage, as you can see. And it gives you details on the other programs that are most commonly sold during this time period and gives you that design worksheet so you can work through details as to the coverage and what the cost will be. So a great way to make certain that we're taking care of you in that regard. Additional things that we offer you through Premier is electronic contracting, our Sure LC, Insurance Bay, whatever shade of lipstick you want to put on that pig. Well, that's there for you to create an agent profile, put all your detail in there, and enables you, particularly if you're looking to contract with multiple ancillary programs. Well, you want a dental vision hearing plan, you want a cancer plan, it may be different companies. Well, doing this electronically can really get you through some things more quickly. On the MA programs and the PD or MA and PDP programs and the Medicare supplement plans, that carrier may require an electronic link specifically to their organization. Well, doesn't work then with Assurance Bay, but it gives us that opportunity to bypass some of the paper that's going in there. I heard a story yesterday of a person in our contracting department that the backup with one of the major carriers was on paper applications, was nearly 90 days, where the electronic process 5 to 7 business days. So there are things that you can do electronically to really speed the process. We do offer discounted errors and admissions coverage for our qualified agent. What makes you a qualified agent? Well, you got a contract with us. But this is a program that you own that will cover you for the requirement that just about every insurance company requires of you now with your own sort of malpractice insurance. You own this and it will cover you regardless whom you contract through. We're a big organization. There are carriers out there, however, we don't have. Probably won't ever. There are other organizations that will have perhaps a shortfall in other areas. So you need to make certain that we're able to take care of you and protect you. And this errors and omissions coverage will do just that. We do also offer online CE bundles for a discount through our association with WebCE, and you have an opportunity to have a modified guarantee issue disability income program placed in on yourself where you're paid a commission on it. So an important thing to make certain that you are looking at your own benefit package that as an independent agent, you're responsible for. I mentioned that this program is being recorded. Past presentations have been as well. They're available on our website and on our YouTube channel as well. So some things that are available to you that speak to marketing to centers of influence in the community, faith-based organizations, working with providers, details on certain niches within the insurance world. Hey, I need a little more detail on disability income. Well, here's where I can go to pick that up. Or, hey, what did he say about marketing to faith-based organizations? Well, it's all there for you, accessible 24/7. I cannot overemphasize, and pardon me, I thought I had that shut off, and I evidently did not, didn't it? The value of the Medicare Center program that's available without cost to a contracted agent, either with Premier Marketing or one of our platform partners. I have a hard time using the JJ Walker free as he does. Good way to get spanked in the old days. But it's a tool that's available to you that has a whole bunch of components in it, and they are improving upon it each and every day, it seems like. This particular week, they came out with announcements of other things that this program will offer outside of a universal log on for 3 different quoting engines powered by, well, Connector, Sunfire, CSG, other tools that are in there that can help you offer those side-by-side comparisons that I mentioned of earlier, and collecting that scope of appointment and storing it for that 10-year period as well. Same thing with the new presentation recording and storage. It's all available to you through this system, and some pretty neat ways of taking care of those requirements foisted upon us. It does have a CRM in there for you to track your business. It gives you then that opportunity, because you've plugged in prescriptions to get the quote that the person's on, how you can compare that with, well, gee, did their drugs that they're taking change? That'll make a difference. How has that plan reacted to the market they've been in for the year? And how do they stack up with other prescription drug plans? So you can do those presentations and take care of it, and that data is in that CRM. There are also different things that come into play, resources in the Learning Center. There's also now Medicare Lead Center that's in there that gives you an opportunity to purchase leads right through this system. The call recording thing I already mentioned, but it's also available now, in 2 days as a mobile app as well. So some great things coming through this program, through a tool that I thought was awesome to begin with. We do also want to make certain that you realize the full compensation to which you're entitled by your sales. You can't get that on MA or PDP programs, but many of the Medicare supplements and ancillary programs do offer those incentives that may help you qualify for the trip with that carrier and get you additional incentives through our organization as well. We want to make certain that if you do like to converse with or use Ma Bell to converse with people, we can provide you a contact list, butted up against do not call, minimal rates, or perhaps even gratis, depending upon your contracting situation, but also give you ideas on how to work for and through those centers of influence, those community marketing programs that are so important to our success as well. There are different carriers that, if you've worked with them throughout the year or have been showing production, the MA and PDP programs, they may well have prospects available to you as well. We do offer an internet lead program, direct mail support, this T65 locator I'll talk about in detail in just a moment. Don't worry, not that much detail. We'll get done here quickly. And a reminder of the different ways of maximizing one lead through multiples through the use of referrals. A great pre-recorded piece there that you can use to do it. When we look at the direct mail programs, they are based on production, and it deeply cuts the cost of that, so you can be consistent with that mailing. That's how you get a regular flow. It's not painful that way, at least as much. You can qualify for two, one based on health programs and one based on final expense. It deeply drops the programs. We do so through vetted preferred lead vendors. We want to make certain that their systems are able to deliver those leads to you as quickly as possible and that they stay compliant. We do also have a program where never distributed direct mail A leads, that means they're fresh, are available to you to fill out your schedule based on, gee, this week I have holes. Last week I was busting it. Well, this is about as high a price as I've seen on this, but that cost will vary by area to area and time of year to time of year. It's a supply and demand thing. How many leads are they getting back in the mail? What do they have to offer in a particular market? So some different types that are available to you there that can fill your schedule. The internet lead programs are through Facebook. Pardon me. There's one for final expense and one for Medicare. These are microwave leads, plain and simple. You got somebody on the internet on Facebook, they're probably clicking more than one sponsored site for this. So, depending upon how these leads come, you may have an individual that's spoken to multiple folks, or they expect, in most cases, a very immediate response as well. So, some things with timing that are very important for us to observe in that area. At T65 Locator, well, that's a program that you download to your smartphone or your desktop. You register for it. They verify that you have a contract with us, and it gives you access to the geography of some folks in different areas. A great way for you to maximize your time in a particular area if you stacked appointments and one cancels. Also a great way to look at, well, a quasi bit of a heat map. That's part of the CSG program in Medicare Center as well. Some really cool things that can help in there. Well, this gives you some plain old geography right on your phone. That referral program is not just for selling. It's for your book of business as well. That's a way to make certain that we realize the value of a CRM program. And if that person's comfortable with their coverage, that's where they want to stay. Great, we got renewals, but they may know folks that are in need of your help. And so that same process comes into play. As I really look to the end of this presentation, what we look to do with this is garner an opportunity to work with you because you want your business. And we want you to feel comfortable with referring us to your agent friends as well. It's all then a way of practicing the cross-selling pieces through the CSG thing. One of the things that you'll see as a part of the follow-up is a link to how you fill the gaps in Medicare Advantage plans with the HIP program, how you can quote the dental vision hearing programs right through that. We put it as part of our marketing plan. We put it in play as quickly as possible because, hey, for a couple days yet through the end of the week, we still have a 10-1 effective. We have an 11-1 effective, a 12-1 effective to sell to as well. So putting it in play quickly can make a big difference to you. So all that said and done, I want to check and see. Yes, my verbosity has put many people asleep, but there aren't any questions here that we need to look at. So at this point in time, what I want to do is thank you. I appreciate the folks that have done business with us here at Premier in the past. We look to grow upon that experience and make the cross-selling pieces of this work for you. Because in that fact-finding process, we might find CDs that we can utilize for an annuity, or we might have an individual that's comfortable with their base medical, but gee, we're now dealing with mom and dad because they're in their 80s and they're going into a long-term care facility. We want to make certain we're covered for that. So whatever it happens to be on how we can grow that relationship with you as a contracted agent, we look forward to doing so. And your agent success manager, your marketer, helps you in that regard. For the folks that are on this call or come on this call and haven't done business with us, we welcome that opportunity. We would look forward to being able to serve you as best we can with the programs that are out there and help you be successful in your chosen field. And of course, I want to thank everyone for the investment of the time that they put into listening to this, because that's your most valuable resource, your time. And until we're able to visit with you again, I thank all three categories, and I wish you good selling. Thanks so much. We'll talk to you soon.